What to watch? Hypothermia is one of the greatest dangers facing people who work in the cold. This medical emergency occurs when the body temperature drops below 95 degrees Fahrenheit. According to OSHA, an important, milder symptom of hypothermia is uncontrollable shivering, which indicates the body is losing heat and trying to rewarm itself. Other symptoms include fatigue, confusion, loss of coordination, and slurred speech. People in the late stages of hypothermia may stop shivering or lose consciousness or have blue skin, dilated pupils, a slowed pulse, and slower breathing. In cases of hypothermia, call 911 immediately. Move the victim into a warm, dry area and remove wet clothing and replace it with dry garments. OSHA suggests wrapping the victim's entire body, including the head and neck, in layers of blankets with an additional vapor barrier, such as a tarp or garbage bag. Don't cover the victim's face. NIOSH says to first concentrate on warming the center of the victim's body, the chest, neck, head, and groin. If assistance is more than 30 minutes away, OSHA recommends giving the victim warm, sweetened drinks, but no alcohol, if he or she is conscious. You can also place warm bottles or hot packs on the sides of the chest, groin, and armpits. Be prepared to give CPR if the victim isn't breathing or has no pulse. Other major types of cold stress. Frostbite. This condition is the result of freezing skin and surrounding tissue. In severe cases, it can lead to amputation of body parts or severe damage to the body. Signs include white or gray patches on the fingers, toes, noses, and earlobes. Skin also may look bluish, gray, pale, or waxy. Workers affected may complain of tingling, loss of feeling or aching, or having blisters. Anyone experiencing frostbite needs to be taken to a warm place as quickly as possible, and medical personnel should be alerted. If the feet or toes are affected, don't let the victim walk because it could cause more damage, NIOSH says. More first aid tips for frostbite include: once indoors, remove any clothing or accessories that might hinder circulation. Immerse the affected area in warm, not hot, water. Temperatures should be comfortable to the touch, especially for unaffected areas of the body. Use a loose, dry cloth to protect the frostbitten area until medical help arrives. Don't rub the affected area. This could damage the skin. Don't warm the frostbitten area with direct heat from items such as a lamp. This can cause burns. Don't thaw the affected area if it has the potential to freeze again, because this can cause additional damage. As with hypothermia, you can give someone experiencing frostbite warm, sweet, non-alcoholic drinks. Trench foot. Also known as immersion foot, trench foot can occur in temperatures as high as 60 degrees Fahrenheit if a worker's feet are constantly wet, NIOSH says. Warning signs include reddening skin, tingling, numbness, leg cramps, and blistering. Among the steps to take if a worker is suffering from this condition: remove shoes and wet socks, dry the feet, and instruct the person to avoid walking, which can further damage tissue. Chillblades. Chillblades are the painful inflammation of small blood vessels in the skin that occur in response to repeated exposure to cold, not freezing, air. According to the Mayo Clinic, NIOSH adds that the condition can occur in temperatures as high as 60 degrees Fahrenheit. Symptoms may include redness, itching, and blisters. Victims should avoid scratching the skin, which should be slowly warmed. Cold weather and COVID-19. If you're working outside in the cold and wearing an item such as a ski mask or balaclava, is that enough to protect against COVID-19? Possibly. Items with multiple layers of fabric that cover the mouth and nose would be similar to wearing a cloth mask, NIOSH experts told Safety Plus Health. However, they noted that some ski masks, balaclavas, or similar items can have openings around the mouth and nose, making them insufficient protection. State and local regulations may vary on cloth facial mask requirements for outdoor workers, but the Centers for Disease Control and Prevention recommends the use of masks when in public and around people you don't live with. While there are no additional risks associated with wearing a mask or N95 respirator in the cold compared to not wearing one, if a worker feels that working in the cold is having a negative effect on the respiratory system, they should consult a health care provider about their individual health concerns, the NIOSH expert said. An occupational safety and health professional should work with the employee to determine the most appropriate cloth face covering or respirator for their specific workplace settings.